My name is Aelaf Worku. I am a U.S. trained physician. I was born in Ethiopia when I was a year old. Spent 33 years abroad before coming back. I work with the Twinning Center as a Diaspora volunteer, and I wear a few hats. I am the Quality Improvement Advisor to Deborah Brown Referral Hospital. I am the Infection Prevention Advisor to the hospital. I also lecture at the newly established medical school at Deborah University. And my fifth hat is working at the Ministry of Health and working on the new medical education curriculum and initiative, where they've opened up 13 medical schools this year. So the way I heard about the program is I saw a brochure in the hospital where I started as a resident, my intern year, and it was advertising that Elmhurst Hospital was doing a program in Ethiopia. I was excited. I went to my mentor. I said, "Are you working in Ethiopia?" He's like, "Oh, it's just getting off the ground. We're just getting started. Nothing, too clear yet." And then I was like, "Okay." I left it alone. So 3 years later, I was finishing my residency. I volunteered in Haiti right after the 2010 earthquake. I mean, it was tragic to see in terms of the patient suffering and the population suffering, but in terms of the mentors, the hardworking, accomplished people, it's just one of those environments that you love to be in when you're serious about what you're doing. And I came back, was telling everyone what a great experience I had, and the same person from first year in residency, Dr. Massey, was like, we got a program in Ethiopia actually if you want to be a part of it. Before I came, I exchanged emails with an author who had been here during his medical training. His name is Abraham Verghese, who wrote Cutting for Stone. And he was a professor of one of my friends. I said, "Do you have any advice coming back?" He said, "Be patient, be a good listener, be diplomatic, and carefully think what you're going to say, and the people in Ethiopia will be very receptive." And I think he's been spot on in terms of the cultural nuance. There are a lot of really, really intelligent people here. Just being here makes you realize how fortunate you are, in that there are people who adversity through less resources have really done something with themselves. And so it's to not take what they have been through or their experience for granted. Don't think that you know more than them. So I think it's just been a really big lesson in humility. The second aspect is people do work really, really hard here, amazingly hard. But to make ends meet, they may have to do things that take up their time and exhaust them in ways that you don't appreciate on the surface. I think really getting to know the people here on a personal level, how they work, has allowed me to get some buy-in in terms of changing things as well. I've mentored some people here, be it the quality improvement team, some people on infection prevention. There's an interaction there that I appreciate, and they've taken what I've done to heights I could have never expected. And that also applies to the work at the Ministry of Health as well. Being supportive, being patient, being attentive, paying attention to nuance and the potential this country has. It's genuinely amazing, and I've just been glad to be witness to it. I've enjoyed myself so much here. I was only supposed to be here for 4 months. This is month 16. So approaching the end of my first extension, I had noticed that there were some patients that didn't have the outcomes we would have liked. And it was in part because the GPs and even some of the seniors had not had the experience managing certain critical cases. It was a point basically about education, because once you actually showed the people how to do it and the theory behind it, they took to it very quickly and they understood. So it was like a gap, an educational gap. That's very hard to do because it's very labor intensive and time intensive. And so what I said is, let me shoot some videos and donate it to our hospital and whoever else wants it, and use it for educational purposes. Well, there was a visit from the Ministry of Health because they were working on a program to expand the number of medical schools, but also the training. And I had a conversation with the person heading the program at the time, Dr. Yodit, and she said, we're doing this program, what you said is really, really good. Would you like to be a part of what we're doing at the Ministry of Health? And so that's how I ended up in the Ministry of Health, and my role has gone from just simple advisement and giving ideas to doing training to teachers and administrators about how to teach and about the new curriculum that we had been put together before I got there. And then since then, I've been involved with policy-making decisions, procuring equipment, suggestions about which textbooks to get. And I, as well as one of the fellow volunteers from the Twinning Center, Alam Sagad, authoring a hematology curriculum. Rarely in your life will you ever get the chance to be a part of history. That's my take on this. The Ethiopian healthcare system has changed a lot within the last 7 to 10 years. The number of medical schools has increased, the number of doctors has increased, but at the end of the day, the impact on health we've seen to some degree, but they're attributable to other things that have been done outside of the training of doctors. This is for the first time in a long time, on a large scale, a revamping of the medical education curriculum. You have some great schools like St. Paul's, for example, but that's on an individual basis, and it's the idea of starting a bunch of new medical schools, modernizing their curriculum. It's great on paper, and there's some really great people working on it. You need bodies, though. You need volunteers to come up with the curriculum. You need volunteers to teach the curriculum. You need volunteers giving input to the Ministry of Health and to the individual medical schools. Now, being a volunteer is great as an individual and doing some stuff at the hospital. The reason I'm really a fan of this medical curriculum is that you have the chance to impact the healthcare system. And what I mean by that is, let's say I were to stay here and I were to see 50 patients a day, just new patients, 6 days a week. That's 300 patients a week. In a month, that's 1,200 patients. In a year, that's roughly 8,000, 9,000 people. Over 20 years, you still haven't seen 0.1% of the people in this country that need help. As an individual, doing individual things, it's hard to make a difference. As an individual, being a part of the system, changing how the system works, it's a multiplier effect. For every 5 GPs you mentor and you train how to be doctors correctly, they go out and they train how many more they do. And then that's how you have scope, and that's how you have impact. And I just hope that whoever watches this gets that idea that you can really leave a lasting impression on a lot of people.